In News for Your Health this morning, the Spokane Regional Health District confirms a second case of measles in Spokane. This comes just a week after the first confirmed case in Spokane in 20 years. Officials say anyone who went to Madeline's Cafe April 23rd from 7:30 in the morning to 3:30 in the afternoon, or to the Winco on North Nevada from 5 to 8 at night, or Madeline's on April 24th from 7:30 to 3 could possibly have been exposed. KXLY4 working for you with what the health district is doing to combat this public health crisis and to keep you and your family safe from measles. We are joined in studio by epidemiologist Dorothy MacEachern, and you're really setting the record straight. First of all, let's talk about those businesses where that person was. They're safe to go to.
Absolutely. So when we give this information, we're very specific about the time and location. And with those, we know the individual was in the business at that time, and we also build in a 2-hour window after the person left the business, because measles can float in the air for up to 2 hours after a person leaves. So that's built in, but after that there's no risk.
Okay.
Unless the person is in the facility again, which we saw in Madeline. So the individual was there those 2 times. And that's it. There's no risk in going to Madeline's or Winco.
Okay, we've been told you're blowing this way out of proportion. You know, you guys in the media are making a big deal about nothing. Measles are not nothing.
Right, they're not nothing. These 2 individuals have been quite ill, and they are generally healthy adults. So if a person who was a baby got this, they can go on and develop pneumonia, encephalitis, severe ear infections. They could die. It's rare, but it's possible.
Vaccines are really the thing to do to prevent.
Safe and effective. We have a great vaccine that's been around for decades, and there's no good reason for an individual not to get it. There's a small number of people who can't get vaccinated, so children under 1 year of age, and people with severe immune compromise. If they hadn't been already vaccinated, they can't be vaccinated. So part of the effort is to protect those most vulnerable people in our community.
And some of the information that's been coming out, you know, there is a quarantine for some people who've been exposed, correct?
Right.
Who are they?
So those individuals would be close contacts of the cases. So the original case, in fact, that's how we detected the second case. And that allowed the case not to go through a medical setting, because we were monitoring this person daily for symptoms. We knew there was a close contact with the case. So every day we're talking about temperature and other cold symptoms, which is how measles begins. And so with knowledge that this person was developing a fever and had some other symptoms, we were able to conduct the proper testing. We had someone who was protected against measles go out and draw the specimens and sent them over to the state lab. So this person was quite sick but didn't need hospitalization or medical care, and we kept them out of the medical system. So this is what we can do with all people that we know are not immune to measles, and we are monitoring about 20 people still that have no documented immunity.
And you're monitoring them, but they're not under quarantine?
They are under quarantine.
That's 3 weeks, right?
So it's 3 weeks from their last exposure, because that's the maximum amount of time that measles can incubate.
That's a long time.
It's a long time, yeah. So we have encouraged people to get their titer drawn, so it's a blood draw that can indicate whether they have immunity, because it's possible that some of these people are immune, but we want documentation of that, and we can't always get old vaccine records.
And really quickly, we're almost out of time, but we've got Bloomsday coming up, where we're talking tens of thousands, 100,000 people being downtown. Do we need to worry?
I would say for people who are developing cold symptoms, particularly if they're unvaccinated, it would be best if they stay away from the events, and particularly the trade show. With the outdoor venue, it's a little less worrisome, but getting people in an enclosed space with recirculated air, That's the major concern. And most people are vaccinated, so that's lucky for us.
Okay, and that's really the way to go. All right, epidemiologist Dorothy MacEachern, thank you so much for coming in, clearing things up for us. Sure appreciate it. We will keep you up to date on this community health situation, the latest right here on KXLY4. And you can always join us on News Radio 920, online at KXLY.com, and our social media sites. And we'll be happy to answer any questions that we can and direct you to the right people who have the answers.